Good afternoon, Haifa. How are you? Nice to see you again. So today we're going to work on your cardiac assessment, abdomen, and lungs. Okay? So starting with the lung assessment, I'm just checking your anterior chest for any scars or tissues, and your posterior back for any scars or tissues. And thus far, it looks very clear. So coming around, I'm going to move your hair. Thank you, Haifa. The first thing I'm going to do is palpate your spleen. I'm just making sure that it's midline and the vertebrae are appropriately spaced, and thus far it is. I'm going to use the pads of my finger just to check the thoracic entablement, and I'm going to go in between your scapular, underneath, and out. And now I need you to say 99 for me, please.
99, 99, 99, 99, 99, 99.
To check for thoracic and expansion, can you please inhale and exhale for me? I'm placing my finger at T10, and so far it's even and good. Thank you, Haifa. So now I'm going to auscultate. Before I auscultate, I'm going to check for the CVA. I'm going to place my hand over the flank area and thump it. And this is just to check, is there any tenderness or do you feel any pain?
I'm fine.
Okay. Okay. So now I'm going to auscultate her lung sounds. And at the very top, I'm supposed to hear bronchobesticular. Breathe in and out through your mouth for me, please. Thank you. And you want to make sure that you go in between the scapula and not over the bone, because you're listening for an air sound. In the lower lungs, you're supposed to hear vesicular lung sounds. Moving to the front, I'm going to use the pad of my finger just to check again for thoracic entablement. Also, I'm going to do 99. She's going to say 99.
99, 99, 99, 99.
Okay. Right here, I'm going to check for diaphragmatic expansion. Go ahead, breathe in and out. Breathe in. And it's appropriate. Now I'm going to check for, I'm going to auscultate for the lung sounds. Breathe in and out, breathe in out. Okay, and it sounds great. And that concludes the thoracic assessment. Okay. Now we're moving on. How long was that? Moving on to the cardiac system. The first thing I want to do is inspect the chest, and she hasn't had any previous surgeries and no marks on her chest. I'm going to check for bilateral radial pulse, posterior tibial pulse, and dorsalis pedis pulse. And all of those were even. I'm going to check the carotid pulse, but I'm looking for double pulsation for JVP. And the proper way of checking this is having the patient lie supine with the head of the bed 30-degree angle. All right, so I'm checking for the carotid on both sides, not at the same time. I'm going to auscultate. There's no bruise heard on auscultation. And now for the cardiac sounds, at the right sternal border, the aortic, pulmonic, Erb's point, the tricuspid, and the mitral. Using the diaphragm of the stethoscope, S2 is heard loudest at the aortic, the pulmonic. S1 splits at the tricuspid valve, and it's heard loudest at S1 is heard loudest at the mitral valve. So while she's sitting up, lean forward for me, Harper. I'm going to use the bell of the stethoscope to listen for S4. Breathe in and out through your mouth. Aortic, pulmonic, tricuspid, and a mitral valve. Okay, now I'm going to have her lay back and lean on her left side to check S3. So I'll use the bell of my stethoscope and go to the mitral valve, and it's clear. And that concludes the cardiac assessment. On to the abdominal assessment. The first thing I want to do is inspect for heaves, the contour, make sure it's symmetry. And then I want to auscultate the vowel sounds. Starting at the right lower border, moving over to the left lower border, left upper border, right upper border, and what I'm checking for is vowel sounds. And now I will check for the arteries. So find the abdomen, the umbilicus. To the left or to the right side of the umbilicus, the first artery is the aorta. Then you have renal artery, the iliac artery, and then the femoral artery. Now I want to palpate for the aorta artery. So I'm going to use my thumb and my index finger and palpate just below the umbilicus, and it shouldn't be no more than 2 centimeters. Okay. So now I'm going to percuss the abdomen, and I'm going to start clockwise and percuss the whole abdomen. It's down first. And this is the liver on the right side. Large and small intestines at the lower abdomen. And going up is the spleen. And you hear the sounds change because the organs are more, the sound is more dull. And that's the stomach. So now I'm going to measure the liver, and I'm going to start at the 5th intercostal space and work my way down. Okay, so right here is the liver because I hear a dull sound. Make my mark. Then from the upper right quadrant, I'm going to move up until I hear that dull sound again, which is right here. Make a mark. I'm going to use this ruler and measure it, so it should be no more than 5 to 6 centimeters, which is no more than 5 to 6 centimeters, so her liver is normal. Going over to the spleen, the mid-axillary line, the 11th intercostal space, I'm going to percuss. That is the first border. The anterior border of the spleen is the anterior axillary point, and I'm going to percuss right there, and that's the spleen area. So now I'm going to lightly palpate the stomach, the abdomen, and in a clockwise position, and watch the patient's face while I'm doing this for facial grimacing. Do you feel any pain? No. Okay. What about now? Oh, what about now? No? No? Okay. Now I'm going to palpate a little bit harder to see. Do you feel anything? No. Okay. All right. Now I'm going to palpate the liver. I'm going to take my left hand and place it underneath her back area. And I'm going to, I'm so sorry. Okay. And that's the liver. To palpate the spleen, I'm going to take my left hand, place it under the 10th, 11th intercostal space. And the spleen is not normally palpable, only unless it's enlarged. And that completes the abdomen assessment.